Alright, we're going to go over some ethical considerations when using the BDI. So first of all, we've mentioned beforehand that you really need to be careful with items 2 and item 9, mainly because these items relate to suicide ideation, and especially if orally administering the test taker really wants to get a sense of how the client feels about these two questions and whether they need to probe further. We also mentioned that this should not be used as a sole diagnostic measure. It's not the only measure to diagnose depression. The manual really emphasizes that in some cases, the BDI-2 may just simply be a reflection of the degree of depression and not the diagnosis of depression. So really need to make sure that this tool is not the only thing that's used. It's more for screening or to see if the treatment is working properly. Other ethical considerations could include response bias. So being aware of if the client is scoring higher, so they want to be if they're trying to score higher, or if they're trying not to include their actual thoughts towards suicide, so scoring less. Also, it's important to ensure that the client is not exaggerating some of the answers or manipulating some of the responses, and that could be the benefit in administering this test orally, because the clinician who administers orally would have a sense of, they could observe their facial characteristics or just kind of get a sense of how they're actually reporting the answers. One big ethical consideration that needs to be made is when standardizing this instrument, like I said earlier, really not much in the manual on minority populations, especially when norming the test. The minority populations were less than 5% for both sample groups, the college and the normal sample group. And looking at the manual and on online information, all of the research points towards really needing to kind of test this instrument out on different populations, because different groups may actually interpret depression differently, or some of the items may not be relevant to their culture.